Thank you very much, Caroline, for synchronizing us for more than an hour. And at the end, our marketing director, Maria, to saving the situation and
Yes, thank you, Maria.
private email. So, Maria, it's up to you if you want to listen to the webinar with us or you disconnect. But well done. Thank you very, very much, everybody, for waiting. I apologize for this delay, but let us now get to the point. So
I'll let you know.
I will allow myself to talk tonight about egg donation and PGS. So the problem is that now in Europe, the women are very modern. They study, they grow their careers, and at the age of 35, 40, they want to have a family and they think about having children. The problem is that our biology is not aware of this modernism, that our biological clock is the same as it used to be 100 years ago. We women, we are designed to have children before we are 35 years old. It's due to the eggs quality. We can see in the lower curve that the success rate with patients' own eggs are very, very high until we are 34, 35 years old. Then our fertility drops down dramatically. So at the age of 44, it's almost impossible to be pregnant with our own eggs. And this is the moment where we have to consider egg donation. On the other hand, in the upper curve, we see the pregnancy rates with egg donation. So we can see that the rates in egg donation cycles are age independent. You can be as well pregnant through donor egg when you are 35 and you are in premature ovarian failure, or when you are 48, 50 and you are in your natural menopause. The problem is that when the time goes by, we have to verify where are you in your infertility treatment. So when you are coming to IVF Spain, we do on the day of the first appointment a quick revaluation of your fertility. Means we check your ovarian reserve. We see your age, your AMH, and your antral follicle count. And then when your AMH is low, under 1 nanogram per milliliter, then egg donation is recommended, and the bad situation that is due to your own eggs and poor ovarian reserve, we can change to a good prognosis through egg donation. So when patients are, coming for egg donation, they want to be pregnant as soon as possible. Quite often they wait for children a long time. They have many unsuccessful IVF cycles in their story. So here we see that the success rate in egg donation when we put embryos on day 3 of development, the morulas are about 30-35%. So this is not something that we would like our patients to achieve at IVF Spain. The goal of the treatment is to develop embryos to day 5, to the blastocyst stage. And then you can imagine that embryo on day 5 of development has 150, 200 cells. So if somebody makes this natural jump from 8 cells on day 3 into 150, 200 cells on day 5, we can imagine that only the strongest embryos are going to make it. To achieve the pregnancy rates about 50-65% per transfer. For some patients, this is not good enough. And when we examine embryos genetically, means when we perform a trophectoderm biopsy, we take 2-3 cells out of blastocysts and send it to genetical testing. In IVF Spain, it's performed through new generation sequencing, which is very modern, very comprehensive, because we see all the chromosomes. Basically, we can tell you if your embryo is healthy or not. The pregnancy rate per transfer are about 75%, and your cumulative pregnancy rate per cycle is more than 90%. In IVF Spain, when we have complicated cases and we have to go for the second donor, which we match then to you immunologically with your HLA, we have almost all patients pregnant. So here I allow myself to present the euploidy rate, means number of genetically normal euploid blastocysts, which is age dependent. You see, when we have young donors, the average euploidy rate is about 61%. When we have patients under 35 years old, about 50% of embryos or blastocysts which they generate are genetically normal. The problem starts that the older we are getting, the lower number of genetically normal embryos we generate. So as I say, at the age of 42, 43, there's almost none genetically normal embryos that we have. And then with our own eggs, and then we have to consider egg donation. So in IVF Spain, we perform two kinds of cycles. The first type of cycle that we do is with patients which still have their ovarian reserve, which are older than 35 years old, between 35 and 42. We perform IVF or embryo banking cycles with pre-implantation genetic screening. It means we are looking for genetically normal embryos in this age group. We see that without genetical testing, pregnancy rates are very low in this age group. With genetical testing, the pregnancy rates after three consecutive transfers in IVF Spain with patient own eggs are over 80%. When we perform egg donation without genetical testing, after 3 consecutive transfers, we have more than 90% of patients pregnant. So the egg donation and PGS cycles are usually performed by the second attempt by the second egg donor to make time to pregnancy as short as possible and to guarantee the sensitivity of embryo selection as high as possible. So through egg donation, we believe we found a solution for patients that cannot have children with their own eggs anymore. We generate usually a genetical father, psychological and physical mom, and this quite often brings balance to a lot of patients that are trying for many, many years to be parents. So this is the classical way which we use in IVF Spain to choose a proper donor for you. So there are 4 steps of choosing a donor for you. The first step means that egg donation here in Spain is allowed since more than 30 years. So Spain has the longest experience in egg donation in Europe. So the more often you do it, the better you're getting. In IVF Spain, we have more universal sex life, about birth control pills, about sexually transmitted diseases, about necessity of using condoms, and we teach them that they should have children before they are 35 years old. When I say to these young ladies, they look at me, and everybody is laughing. So then I allow myself to present the numbers with genetically normal embryos, which are age dependent, and then nobody else is laughing anymore. There's a lot of young girls that are coming to IVF Spain. They perform social freezing. They freeze eggs for themselves for the future. We want them to have at least 20 eggs for themselves frozen. And if they decide to be our donors, means to do 2-3 cycles for our patients, we offer them social freezing for free. We have to make sure that the process is safe for you. Means donors are regularly tested for infectious diseases. They undergo genetical testing for the most common recessive diseases in the European population. They undergo psychiatric evaluation and drug screening test. According to the Spanish law, your donor has to be under 35 years old. In IVF Spain, we want your donor to be under 30 years old. According to the Spanish law, we have to generate a child that will explain the combination of you and your husband, and then your egg donor and your husband. I always say to patients that I have to find you a twin sister, somebody who looks like you, has the same color of hair, color of skin, the same body shape. So when the child is born one day, and in a couple of years will run around us, everybody has to think that you are a genetical mom. So the 500 donors that we have are in 4 groups. Phenotype 1 are donors with blue eyes, phenotype 2 green, phenotype 3 brown, phenotype 4 girls from Asia and Africa. So in the second step, when you fill in your phenotype questionnaire, when you describe yourselves, you tell us, it's super important for us that you tell us what is important for you, which characteristic of yours your donor shall have. We put you into the certain phenotype depending on your eye color and skin color. Then once a week, every Tuesday, all the doctors that we work at IVF Spain, we have a meeting. We are 3 ladies, 3 gentlemen, and I show to my colleagues all the patients that I've seen over the week. They show me theirs. We are blessed in IVF Spain because we have different backgrounds, different residency schools behind us. Basically, the doctors at IVF Spain speak all European languages fluently. So we discuss our patients between us. The computer has an automatic system that shows me the shape of your face, nose, mouth. And then eventually, with the doctors, we decide who will be the best donor for you. We call donors and ask for the availability. This is the genetical testing that Spanish law obligates us to perform on each donor, and to make sure that donor is not a carrier of cystic fibrosis, muscle dystrophy, and some other common diseases. For patients that are immunologically complicated, that need a second donor, the second donor is usually matched with your HLA. We are that far that in IVF Spain, we match donor to you like tissue. From the immunological point of view, the donor, the egg donation is like a liver, like a kidney. So we are that far that we match HLA of a patient to HLA of a donor. and we know exactly which logically you can accept the best. For andrological issues, of course, magnetic cell sorter. We are not afraid of complicated andrology. We have men putting their gonadotropins regularly before we do the fertilization. Coming back to embryo development and genetical testing. So the crucial thing is embryo development into day 5. So this is day 3 embryo, 8 cells, day 5 blastocyst. Here you have a beautiful picture of embryo hatching. This cloudy here structure is the part of embryo that wants to come out, wants to attach. You can imagine that this is the body of an embryo. And here the embryologist is generating with the laser a small hole, and it's taking out 2-3 cells for genetical testing to check euploidy. Of course, embryos after PGS in IVF Spain, they have to be frozen, but no worries with frozen PGS. Euploid egg donation embryos, we have higher success rate than with fresh embryos. So the technology that we put into the embryo development and embryo selection is the key to a quick success. We focus on putting embryos on time to the lining in cases that do not implant euploid embryos in the first attempt. We routinely perform uterus lining biopsy. We do not wait for recurrent implantation failure. We do not wait for 3 transfers that you are supposed to fail and then diagnose the lining. Basically, after first unsuccessful transfer, the receptivity of a lining has to be checked. There will be other webinar where I'll be discussing the receptivity. The implantation rates, pregnancy rates with PGS and egg donation are sky high. The program that is most commonly selected in IVF Spain is exclusive egg donation, where we guarantee you at least 16 eggs of a donor. They develop to the blastocyst. The blastocyst rate is usually 50%, but the clinic gives you a guarantee of 5 embryos on day 5 of development. And then there are 2 ways of choosing which one of those blastocysts is the best for you to transfer. The first is to put embryo to an incubator, to a special time lapse that is watching the embryo and tells us if this embryo has reached certain stages of development in the certain time. I am famous for saying that with good-looking embryos is the same story as with good-looking men. There is a moment in your life when you trust that you control them, and that genetic testing seems to be the smartest solution. So out of this 5 blastocysts that we generate, it can happen that 1, 2, 3, or all embryos are genetically normal. In my career in IVF Spain, I have seen the same donor in 1 cycle having all embryos, all blastocysts euploid, and I've seen the same donor in the 2nd, 3rd cycle after 2-3 months having non-embryos, which are genetically normal. So would like to present here an American study from 46 centers, where in some of them the euploid rate is 40%, in the other centers is 80%. What does it depend on? Age of a donor, the dose of hormone that you are putting to your donor. You can imagine that if you generate 20 eggs, the euploid rate is higher than when we generate 40 eggs. You can imagine when the cells divide quickly, when we generate a lot of them, it's like in oncology, they can do mistakes and DNA issues. So in IVF Spain, we adjust the dose of hormones to AMH of a donor. Of course, with AMH between 2 and 5, we can allow ourselves for middle dose protocols with 225 units of allotropins. With AMH more than 5, the dose has to be lower, 150 units. In the study that we present, we see that the aspiration has an impact on euploid rate. If the negative pressure that you use is too high, you basically destroy your eggs. In IVF Spain, there are 2 professionals that do egg retrievals. It's me, myself, and Dr. Sergio Rogel. So we collect all the follicles, all the eggs that donor has, and even the small follicles, 10, 12 millimeters, have mature eggs. And the euploid rate between me and Dr. Rogel is the same. So the culture media and pH values also are very important. In IVF Spain, we have comparable euploid rates to good American centers. So basically, in the first egg donation cycle, PGS is not done routinely, but in the second attempt to make the time to pregnancy as short as possible, we perform it. So here, our results from 2016, we do every month 20-25 donation cycles with PGS, and you can see that clinical pregnancy rates with fresh eggs without genetic testing are about 60%. With egg donation and PGS, the pregnancy rates are 15% higher. So in our clinic reviewing 2017, the most common program that is chosen for our patients is an exclusive egg donation plus, where we guarantee you at least 5 embryos under 5 of development. The key to success are young donors with proven fertility, the donors that have their own children, or from her eggs we have children in our patients. The protocol that you use for donors should be antagonist, should be safe for them. You can imagine that I work in IVF Spain almost 8 years now, and I have never seen in hyperstimulation. We have donors that after egg retrieval are going after 2 hours home. The emergencies after egg retrieval in IVF Spain happen once every 2 years. Yeah, so you have to know what you're doing, and the protocol has to be, the dose of hormones has to be AMH adjusted. My dream for 2019 will be to perform a study between patients receiving fresh egg donation and PGS embryos prospective study to compare clinical pregnancy rates. And then I hope next year at the next webinar, we will know what's the best for you. Thank you very much for your patience. Caroline, if there are any questions, I'll be more than happy to answer them.
Of course, I do already see we have lots of questions, but first of all, thank you for the presentation. Okay, I believe everyone has found many interesting information for that. Okay, let me have a look. We do have the first question. So let me publish this one. It is for Michelle. I've had 6 embryos transferred so far over 3 cycles of IVF in England, but none have implanted. I have 5 frozen embryos left on my 3rd cycle. Would you recommend that I try PGS for these 5 that I have left? I'm 38 with an AMH of 27. My partner is 42 with good sperm. I have blocked tubes, which is the only issue that I know of so far. So it is frustrating that an embryo is yet to implant. I've not yet had any tests for my body. I've had tests for
Okay, madam. The tubes that are blocked are not issue for reproductive medicine at all, because you can imagine that we generate embryos in the lab, and then we put them to you in a certain moment of a cycle through the cervix. So I am like going around the tube, and so I wouldn't worry about this at all. The thing is, what we watch in IVF Spain is that the more cycles patients undergo, the more demanding endometrium you are having. So there are 3 reasons why the IVF cycles fail. First, that we transfer genetically abnormal embryos. That with 38, your euploidy rate is about 20-30%. Means out of 10 embryos, 3-4 should be genetically normal. Yeah, I know that PGS is not done routinely in your country. That the embryos are transferred consecutively, one after another, hoping that one of them will be euploid, and the cumulative pregnancy rate per cycle will be 30-40%. So there is no way back. The embryos frozen, now to thaw them, biopsy them, it's not good. Yeah, the PGS is the best performed on fresh blastocyst. Yeah, but if you were not to get pregnant with your own eggs, the second attempt, I'll be happy. And every doctor in IVF Spain will be more than happy to help you to perform an IVF with PGS due to your age. Then we'll have to focus on putting your embryos on time. Before putting embryo back to you, I will recommend to do the uterus lining biopsy to see how many exactly days of progesterone you need to open implantation window. Majority of our patients, 70% of all the patients, need 5 days progesterone, except 5 days blastocyst. But I've seen in my career girls that wanted 7-8 days progesterone to open implantation window. Yeah, about immunology. By performing the uterus lining biopsy, we verify number of your NK cells. So basically, we will be able to establish if you need an immunological protocol or not after biopsy. Yeah, I hope I could answer your question.
Perfect. Thank you for the question and the answer. Okay, let's have a look at the next question from Francesca. I'm 54 and using young mid-20s donors from good agencies, so I'm expecting the embryos to be good. My fertility clinic wants me to PGS test all of the embryos, but at $800, it will be very expensive. How many embryos would you recommend to have tested to guarantee at least one healthy embryo? My main concern is my uterus has only reached 5 millimeters, and so I am concerned the embryo won't stick. This is off topic, but I'm not sure my doctor is being completely transparent about my chances.
Okay, $800 for PGS testing. Trust me, it's a very good price, because in Europe, usually patients are paying 2,000-3,000 euro for 6 blastocysts tested. Okay, so you have to ask your doctor how many embryos will be tested for 800 euros. If the answer will be 6 blastocysts, it sounds to me like a good cycle. go for it, yeah. And then the good news for you, madam, is when you do PGS, the embryo is frozen. So basically, we do not have a pressure that you are synchronized with the donor, and then the fresh embryo has to be transferred to you after donor egg retrieval. Yeah. In PGS cycle, I can grow your lining in something called long cycle. Usually, when we grow the lining, we do it in a substitute cycle, means patients are taking estrogens orally for 14, 15 days, and then we add 5.5, 6 days progesterone, depending on your implantation window. When I have an issue with the thin lining, I can grow the estrogen phase, not 14 days, 20, 30. In IVF Spain, we have sometimes patients that grow their lining 2 months, and they grow it until I like it. Yeah, so until the long cycle is performed until you reach a certain thickness. Yeah, so don't get disappointed. Yeah, you can imagine I was raised in Detroit area and used to work in Western University, Michigan. The medicine in the States through FDA has certain rules. In Europe, if we have linings which are thin, we also use Viagra, sildenafil, vaginally. I sometimes let Viagra vaginally is good for you. Okay, and then through high dose of estrogens and Viagra and long cycles, this will be my first approach to you. If we grow the lining a couple of months through long protocols and we cannot reach a certain thickness, means, madam, that you are estrogen resistant. And then to grow the lining, probably you will need natural cycles to make it happen. Yeah, so your doctor will have to decide. PGS is definitely great approach in egg donation. The growth lining is something that you have to work on.
All right, great, thank you. Let's have a look. We have another question from Poppy. How do you know if you have immune problems which cause miscarriage?
Okay, the immune issues with miscarriages are probably 10-15% the truth about miscarriages. How do I know? Very simple. I verify your uterus lining biopsy through measurement of natural killer cells. There are machines called flow cytometers. And then you process the tissue through the machine, and the machine tells me how many NK cells do you have. Machine tells me more. How many? What is your Th1 Th2 ratio? Machine tells me what is your cytokine balance. Okay, this is how I know. I don't like immunology performed in blood because we have to have full respect to rheumatology, to immunology in internal medicine. And then blood is sensitive for rheumatology, definitely for reproductive immunology, the lining is more sensitive. And then if you have high NK cells, we perform intralipid protocol, Th1, Th2 ratio issues, Humira, with patient with cytokine issues and Th1, Th2 ratio. There are amazing papers published about tacrolimus and granulocyte protocols, okay? But first things first, you have to see if you generate euploid genetically normal embryos. If the number of chromosomes in your embryos is okay, if this is okay, and you transfer one stride and you cannot achieve the pregnancy, then look for implantation window and then look for immunology in the womb, in the lining.
Okay, thank you. We have another question from Kelly. I have had 2 cycles using the egg donor. The first did not work, and the second I got pregnant, but at 6 weeks. I
Lost,
lost it
yeah.
at 6 weeks.
Yeah,
Yeah.
yeah, yeah.
I have an embryo left, which we will be trying in February, but I would really like to come and meet your team to see how you can help me and my husband. We were trying for 7 years, and the NHS here kept telling me there was nothing even though I had explained that my mother and my maternal grandmother went through the menopause in their early 30s.
I don't know what is your name, madam, but
Kelly.
trust me, Kelly, German NHS, when I started having my own problems, didn't want to help me much too. So I'm very proud of you that you want to look abroad. I had 2 cases like you in my life where I was transferring euploid embryos from great donors. And I knew that if I were to put these embryos to myself, and I have 2 kids, I would have been pregnant right away. There are some patients that are super immunologically dependent, okay? And we developed immunological study in IVF Spain where when you're and we know that you had 2 donors, recurrent implantation failure in egg donation, okay? Then we verify your immunology and match a donor to you according to your HLA. Yeah, so go for the embryo transfer that you have left. I wish you all the best, all the good luck with this embryo. If this doesn't, happen, please contact patients at IVF.com. We have assistant nurses speaking fluent English, answering your questions in 24 hours, schedule appointments in 3-4 weeks. So, we did everything to get rid of a waiting time. If you cannot come to IVF Spain for the first appointment, we can organize a Skype. We can organize it. Yeah, no problem. Very good luck with this, what you have. And if it doesn't work, I'll be more than happy to help you.
Right, perfect. Kelly has added something here as well. So I also had some extra testing done and it showed my NK cells were the right quantity but too active.
Okay, so the activity of NK cells and number of NK cells is one thing. The other thing is what do these NK cells accept? Yeah, we match HLA to NK cells. So this is a blood test, and we need to know which HLA your NKs are going to accept, and then we match a donor to your NK cells, not to their number, to their receptors on the surface.
All right, thank you. And let's have a look. I believe we have another question from Lara. We recently invested quite a bit of money in an egg donation program, having done 2 cycles of IVF with own eggs. While my partner has slightly poor sperm mobility, they managed to get 2 eggs on each cycle, and with ICSI were able to fertilize 2 grade A embryos on one transfer and one on the other. Unfortunately, there's the second part. They did not implant. However, I had 6 donor eggs with ICSI, non-fertilized.
Okay, so when I see, egg donation cycle with 6 donor eggs, it's a little bit low. Okay, when we talk about cumulative pregnancy rates in egg donation cycles, cumulative pregnancy rates per cycle, I have to have at least 3 blastocysts, 3, not 1. Okay, and 3 blastocysts I can reach from 12, 16 eggs. Yeah, so if you are aware that the fertilization potential of your husband's sperm is low, you need an egg donation cycle with more eggs. Yeah. Then in IVF Spain, the program that we developed, exclusive or exclusive plus egg donation, gives you a guarantee of 3 blastocysts or 5 blastocysts of a donor. If we see that there is a low fertilization potential and we were able to generate only 2 blastocysts from this donor, but you have signed documents for 5, we have to stimulate a new donor for you without any extra cost to fulfill this guarantee. If we see that we have stimulated 2 donors and the embryos are poor, and yeah, we know that from C quality embryos it's super, difficult to achieve pregnancy, then we sit down together, we show you the document, we show you the cycle protocols, and then if we see that we still only, 1, 2 embryos, we seriously consider sperm donation. This will be my approach.
All right. Thank you. Let's see. We have a question from Lily. What is the difference between PGD and PGS if using donor eggs 21-year-old plus donor sperm 47? Which test you will suggest?
Okay, so it's quite straightforward. PGD stands for diagnosis, and S stands for screening. So screening is in genetics. There are 2 types of genetical abnormalities. First is the number of chromosomes, are the numerical mutations, where the embryos that we transfer have bad number of chromosomes, 1 too much in 21, so it's Down syndrome, trisomy 18, Edwards trisomy 13, Pateau. So these are the most common genetical numerical mutations that are due to your age, and pre-implantation genetic screening is the trophobacterium biopsy, is testing for the number of chromosomes. Okay, there are people that are coming to us and they say, listen, we are both carriers of cystic fibrosis. We have a child at home who is sick. So we do PGD when we have both parents or one parent, both parents carriers with recessive diseases, or one parent sick in dominant diseases, to make sure that the embryo does not carry the same point mutation, because there are certain diseases that that the issue is in the punctual mutation in your gene, and the child can develop certain disease. Yeah, so routinely, if parents are healthy, we perform screening of blastocysts to see the number of chromosomes only. Donor eggs, 21 years old, should have 80% euploidy, should have, but as I say, you trust but you control, because in the American study that I was showing you, there are centers that have just 40% euploidy rate, and there are some centers that have 80% rate. So when you see that you cannot, achieve pregnancy with 1 donor, 2 donors in one center, okay, go to the center that is subspecialized in egg donation only. There are a couple of centers in the United States that are very known in Europe that do it well, and in Europe, IVF Spain is one of the centers that performs 700 egg donation cycles a year, fresh new patients. So yeah, the more that you do, the more that you see, the better you're getting. So if you are not happy with your center, go to somebody who is specialized in egg donation only.
All right, thank you. I can see Lily added also that she is 47. So just wanted to check if that.
Lily, 47, it's an amazing age for having a child from egg donation. In egg donation cycles, your age doesn't matter. Spanish recommendation is 50 years old and 11 months. You can imagine that we had few super complicated cases. One of my, super complicated cases was an African lady from Rwanda who had 5 children, which in the war, and she was 54 when she came to IVF Spain. Okay, in order to treat her, all the partners in the clinic, we have to agree that we're going to treat her. On top of this, she has to present medical record from internal medicine doctors, yeah, that she doesn't have a diabetes, they lung function test, their heart echocardiography, a lot of paperwork. Okay, she presented it, and she was 54 when she had a child from egg donation. So with us. So 47 years old doesn't matter to me at all. In egg donation, pregnancy rates are age independent.
Okay, perfect. Thank you for this. We have a follow-up from Lara as well. So should the clinic do research on the donor egg? I took all the meds but ended up with no transfer. And she mentions that she is 46 as well.
Mm-hmm. Okay, so when you see the beginning of my presentation, or you can review it tomorrow, you see pregnancy rate, the first couple of slides, yeah, you see pregnancy rate in own eggs, the red curve, 35, and then pregnancy rate drops dramatically at the age of 42. There is, no chance for pregnancy with own eggs. In egg donation cycle, you see this blue curve that is stable between 35 and 50. Okay, so your age in egg donation, egg donation can cause the miracles. It's like Botox. It's erasing your age. So research on egg donation. In order to do research, in order to do PGS on egg donation, you have to fail a couple of times on fresh egg donation cycles to allow yourself to do PGS on egg donation. Okay, so as I said, you go to somebody who is specialized in egg donation. The reason why I started doing PGS in IVF Spain and egg donation cycle was an amazing couple of 2 lawyers from Berlin. And I was transferring good looking, good morphology, good time lapse, high quality embryos. You can imagine that the lady had DNC because of a miscarriage. And I will never ever forget the genetical report from her miscarriage material. One embryo was a euploid girl, and the other had trisomy 13, okay, the Patot syndrome. And this was the moment where our world went upside down. Yeah. Of course, I expected a lawsuit, but they both came to us. And this lady, this lawyer from Berlin, told me, Natalia, next time when we're going to transfer and we're going to have a second egg donation cycle, can you perform genetical testing on my embryo? Okay, it was the first PGS cycle on egg donation that we've ever done in IVF Spain. It was 5 years ago. We did it. She had a child from PGS egg donation right away, and then we reserved basically PGS for second egg donation. Now, after so many years, I tell you, we have higher success rate with PGS frozen embryos in egg donation than with fresh ones. But I'm telling you this from the perspective of 5 years, 600-700 egg donation cycles every year. Okay, so you, as a doctor, you have to mature to allow yourself for this kind of embryo selection.
Perfect. Thank you for that advice as well. And let's have a look. We have another question. I miscarried a donor egg that was day 5 and PGS tested at 6 weeks. What test would you suggest to check there is nothing medically wrong with me before I transfer my next embryo?
Yeah, I would agree. I would, prepare the lining. American school is, if the biopsy is not available, perform the uterus lining scratch to increase the receptivity of the lining in the following cycle. And if you have good PGS tested embryo, transfer maybe prednisone after the transfer, maybe blood thinners, and let's see what happens. Good luck.
Okay, perfect. Thank you. And we have another question from Lorraine. If you do the exclusive donor with 5 blastocysts, how many of this would you expect to be normal? Can you also explain the benefit of the ER map?
Okay, I expect when the cycle is done properly, 3-4 blastocysts to be normal out of 5. The benefit of ERMAP is there are patients that we call GAP 0. GAP is gravida, pregnancy 0, aborto 0, para 0. Never pregnant, never miscarriage, never delivery. Okay, P is for partus, time is the delivery. So it's like GAP in English, whole. I do not know fact. So I have to answer myself a question. If I have a patient and she's coming and she has never had a positive pregnancy test, is it because of her age that she started too late? Or maybe there is something in her womb that stops those embryos to implant. And this is the moment where we recommend the uterus lining biopsy upfront in IVF Spain. On the other hand, I have patients that failed 1-2 transfers with euploid blastocysts, genetically normal, where I have to ask myself a question. When I have a genetically normal embryo with 70% pregnancy rate, why this embryo has not implanted in this patient? Yeah, and this is the moment where I have to like review your case in IVF Spain. Tuesday is a busy day. Yeah, we have one meeting, which is done. We have second meeting, we discuss all the negative results. So when we discuss all the negative results and we see that you failed 1-2 transfers with good quality blastocysts, this is the moment where we recommend the lining biopsy to see if you need 5 days progesterone to open implantation window or 6 or 7. Believe it or not, we perform at least 700 biopsies a year, and I have few patients that I'll never forget in my life. Yeah, that twice a year you have somebody who needs 80 days progesterone to open implantation window, do transfer, day 5 blastocyst, and this is the moment when the patient is pregnant.
Right, perfect. Thank you for this as well. Lorraine has added, also, do you manage patients through first 12 weeks hormone monitoring to maintaining the pregnancy?
We manage until 12 weeks. Of course, if there are issues later on, we are not running away from complicated cases. There are selected cases with certain complications that we manage with obstetricians till the end.
Let me have a look. Yes, we do have another question from Sandra this time. Do you perform NK cells test from the same endometrial lining sample taken for the ER map, or do you perform a separate biopsy on a different day than the ER map biopsy? How important is the NK test, and is it very different to the test performed with blood sample?
Oh yeah. So we perform the uterus lining biopsy. Usually it's on day 21 of a substitute cycle, and we combine, that the piece of the lining goes for ERMAP. ERMAP is genetical testing of the lining that tells me about the timing of your lining. And then the other part of endometrium goes to the flow cytometer, and then we see the immunology there. The immunology of blood and the lining is completely different. Completely. Why? Because we have a lot of cells in our body, but we have to be able to identify them. How do I identify them? The cells have C receptors, yeah, and then the uterine NK cells express different CDs than the NK cells in blood. So the NK cell population in blood is a lot less sensitive because it's not uterine to your immune issues than the uterine one.
Okay, perfect. Thank you for this one as well. And let's have a look. From Lara, thanks, but at age 46 and fertilized with my own eggs, so why not with donor eggs? My husband doesn't want me to use a sperm donor.
You know what? If the eggs, your own eggs, are getting fertilized with your husband's sperm and donor eggs not, try a different donor. Try. And then if you fertilize fresh eggs once, twice with your partner's sperm, and this doesn't work, yeah, then you can think about donor sperm. But before I say, fertilization with donor sperm, I would like to try this sperm with a different donor and fresh eggs definitely.
Okay, perfect. Thank you. And let's see. I believe there is, yeah, here it is from Doris. If we do the PGS, how many transfer are cancelled because of the unemployed found in the embryo tested? On average, as far as I understand, while increasing pregnancy rates within PGS, we are decreasing the number of transfers, or at least no number of embryos to transfer.
Very good pragmatic question, Doris. Very good. Can you imagine flying to Spain for good-looking embryo transfer which is unemployed and that you are not aware of? Of course, you will have less number of transfers. But I don't want you to have a high cumulative pregnancy rate per cycle. When I do PGS and I do it well, my goal is to reach a cumulative pregnancy rate in one PGS tested embryo transfer. Okay, to make your time to pregnancy as short as possible through this embryo selection. You don't need more transfers. You just need one, twice transfer to have a baby through egg donation and PGS.
All right, perfect. Thank you for that as well. And let's have a look. From Sandra, we have another question. What other tests do you perform when the donation cycle fails? How do you match immunological, the donor? What tests do you perform on the recipient woman, which on the male partner? What are these tests for? You have mentioned them in your presentation. Could you give me more details of these immunological tests?
Sandra, I was raised in the top city, Detroit. Okay. The only positive thing that I remember about Detroit was Detroit Institute of Arts, and couple of hours drive, and we were in Chicago. In Chicago, Mrs. Kilby, okay, is a very known immunologist, and she was publishing which NK cells tests are necessary to implant certain HLA embryos. Drop an email to IVF patient, and Elise or one of the assistants will be more than happy to send you these articles, okay, that we use for immunological matching of patients and donors, okay. Our knowledge about HLA matching is from Chicago, from Mrs. Kilby, that published that in certain immunological constellation, only HLA C1 embryos are getting implanted. Yeah, so I'll be more than happy to support you with knowledge.
Okay, thank you. From Francesca, what do you advise if my uterus does not reach 8 millimeters after taking your advice, extra long cycle, Viagra, etc.? Do you think I should chance having a transfer at 6? And many thanks.
Francesca, you should chance transfer with 6. I have had pregnancy with 6 millimeters. You will not know until you try it. If embryo is good, genetically normal, strong, you have a chance to get it implanted. the goal, the lining that the thickness of the lining that we wish is usually between 6.5, 12 millimeters with utrogestan. Okay, without utrogestan, only with estrogens, it should be about 7.5, 13, because the lining after utrogestan shrinks about 1 millimeter. Okay, so if this is 6 with utrogestan, means it is 7 without. It's not bad at all. Give it a try.
Right. Perfect. Thank you for that. Let's see. From Kelly, we have another question. Does being in contraceptive pill have an effect? I was put in the pill at 15 and stopped when I was 32.
Very good sexual education, Kelly. Well done. Everybody in Europe should be educated like this. If you know at the age of 32 you have infertility issues, you have low ovarian reserve, it's definitely not because of birth control pill. It's probably there are genetic factors that are shown that in a family there are women that use that per cycle they recruit more follicles than other ones, and they use their ovarian reserve quicker. So there are papers published showing that premature ovarian failure runs in the family, mother, sister, cousin had it. Okay, so don't blame yourself. Well done, well sexual education. That you are put on birth control pills to study to your career, and we have to take it from there.
All right, perfect. Thank you for this. We'll be slowly finishing, but I do see we have a few questions, so let's move on to the next one. From
Okay.
Marie, I am 45 due to transfer of 1 or 2 embryos with donor eggs. Next week in Portugal, we have 3 good embryos, day 3. What are success rates transferring 2, or would you suggest 1 embryo? I have never been pregnant, but only starting trying at age 42.
Okay. In reproductive medicine, definitely be on the safe side. Means single embryo transfer. You want to avoid twins. Twins, can be nice pregnancy, but can be an emotional roller coaster. You can imagine that in gynecology, we are nice, quiet people, but when you are pregnant with twins, I have to see you more often, every 2, 3 weeks. I have to see your length of the cervix. If the cervix is too short, then I forbid you to work. And if you are at home and the cervix is too short, I put you to the hospital. Okay, I'm afraid of preterm delivery. So, and trust me, in twin pregnancies, it's either my way or the highway. Okay, so gynecologists, we know exactly what we want to. Yeah, so definitely single embryo transfer. The success rates with day 3 embryos are a lot lower than with blastocysts, and super a lot lower than with blastocysts genetically tested. This kind of cycles are, quite convenient economically, but I wish you all the best. I wish you, that you get pregnant with day 3 embryos. If not, we will be more than happy to grow blastocysts for you, madam.
Perfect, thank you. And let's see, we have another question from Sandra. Do you perform the HLA-B test as well, and are these important for the IVF women?
Sandra, embryos are smart. They do not show mama immunogenic HLAs. HLA-A and B are very immunogenic. And when you do kidney transplantation in the United States, we match about 9,800 HLA-As and Bs to you. When embryo doesn't show it, I don't check it. We check just HLA-C. reproductive immunology, and it makes our life a lot easier.
All right. Perfect. Thank you. And I believe we have the last question for today. Let's have a look.
Good.
When doing a fresh cycle with a donor egg and partner sperm, how long before egg collection would we be needed to be there, and for how long after fertilization, etc.?
Okay, so first things first, we have to meet either physically in Spain or online through Skype to discuss the patient history and plan the cycle. So basically on the day of a first appointment or Skype, you have a medication plan that we write for you. Each medication plan means you need a mock cycle. Mock cycle is a test cycle where when you have a period, you take estrogens orally, data and scan in your country. Then period. Through medication plan, through birth control pills, I synchronize you with your donor. It's super straightforward. You take birth control pills at home, donor takes control pills in Spain. You stop it at the same time, ladies, and then you take estrogens, substitute cycle estrogens, pills only, data and scan, donor parallel to you does injections, IVF cycle, and then all this happens at home. You just let us know. You write us an email and say, hi Alice, hi Isabel, I have a period. And then Isabel knows how to synchronize you with the donor, okay? And then you are flying to Spain, basically just for a transfer. How? When we do fresh egg donation cycle, you have to stay in Spain for about 7 days, where from Monday till the next week, Tuesday, where we do egg collection of a donor, fertilization with your husband, fresh sperm, and basically I need your husband in the time frame where we agreed to work from Monday till Wednesday. Then we wait for embryos to develop to day 5, and in IVF Spain, transferred fresh blastocysts are transferred from Friday till Monday the next week. Okay, so these are fresh cycles. We want you to have 1 embryo transfer. The rest of the embryos are frozen. In case you are not pregnant, you want to go back, we have to do the lining biopsy. You have embryos frozen to have a cumulative pregnancy rate of 90% after 3 consecutive transfers. For those modern ladies that desire to have a PGS cycle, I have a very, very good news. Means on the day of first appointment, if the sperm quality of your husband is good, the sperm is getting frozen. And then when we have a donor prepared for you, and we have fresh eggs of a donor, the eggs are getting fertilized with your husband's sperm, either fresh or frozen. We can decide it, okay? And then embryos are grown to the blastocyst stage, biopsied, frozen. We wait 2 weeks for the result for PGS testing. You are flying for transfer just for 1 day in PGS cycle. It's a frozen embryo transfer, so embryo is thawed in the morning, and embryology lab is working very, very hard. They, 7 a.m. they are at work. They start thawing. At 9, professionals, gynecologists, we are coming, and I want to see all the thawing rates. So from 9 a.m. we start transferring, and the same day in the evening you can fly back home. How it works.
Okay, perfect. I know I've said it is the last question, but we have one more request, okay?
Okay,
from
ahead.
Sandra, as she would be interested to have more details on the egg donation with you, and she would like to contact you and get in touch. So,
Sandra, I'll be more than happy to do it. You can Google me, okay? My name is Natalia Sharp, SZ like zebra, LARB. I'm medical director of IVF Spain, Alicante. You drop email to IVF Spain patients. All the girls that are responding emails have 24 hours to do so. Yeah. I'll be more than happy to help you. Yeah, so if you do it today, tomorrow, probably we can have a chat next week. If you want to come physically, Alice will put you for an appointment in the next available time. So usually it's 2 weeks.
All right, perfect. And of course, you will have, if you have any other questions, anyone, of course, then you can also get back to us to patient@eggdonationfriends.com. We will be more than happy to forward your request to Dr. Natalia and her team. Okay, so feel free to do so. And I guess that will be it for today. So thank you all again for joining us today, and Dr. Natalia for your expertise, your time, and for providing us with so many advice as well, right? So is there anything else you would like to add, perhaps?
Thank you so much for joining us today on a webinar. You know, in the States, we always toward the end of the year at Christmas time, we are thinking about New Year's resolution. So I hope that for you who are undecided until now to form egg donation, New Year's resolution will be at least get in touch with us to see what options do you have, to visit a center to see that there are 700 women from all the countries all around the world, German, English, Russian, French, Swedish. Dr. Alvarez speaks Swedish. They have the same problems as you. They are walking in your shoes, and you have a professional, good team that will be more than happy to support you. Thank you for your time. Have a great evening.
Thank you. I believe that was perfect summary. So thank you all. Hope to hear from you, and hope to see you next week during our next webinar as well. Thank you, Dr. Natalia. Good night, everyone.
Thank you. Good night.
Bye-bye.